My tumor is right here.
23-year-old Melody Sear was told her tumor might be cancerous. She needs a biopsy to find out, but the surgery's been canceled twice.
The biopsy never happened, and I cried a lot and I almost yelled at the surgeon.
In Ontario alone, close to 150,000 people are waiting for surgeries put on hold by this pandemic. Now, some doctors say they've got a plan to get those patients into operating rooms.
It's been all hands on deck so far, and what we're saying is we can't lose focus here.
Computer modeling shows it will take more than a year and a half to clear Ontario's backlog in surgeries. To do that, staff and surgeons must treat over 700 patients a week, and they'll need 265 open beds.
I think a lot of support is going to be required.
Hold off there for a sec.
Surgeon Jory Simpson says he's willing to work overtime. The model recommends operating rooms be set up ahead of time, allowing doctors to move quickly from one patient to the next.
This could allow for an additional 3 to 5 patients to be operated on that day by that surgeon.
But in reality, we haven't received more resources in order to address this backlog in surgery.
Any plan would require added healthcare funding, and hospitals could still see a surge in COVID-19 patients.
And it's quite likely we will. Then we're going to have backlogs that build on backlogs in the world of surgery.
BC had about 30,000 patients step aside during this pandemic. Half have now had their surgeries. The rest were added to a pre-existing wait list of 93,000 people. Manitoba recently spent $2.5 million. Its plan is to send waiting patients to public and private clinics for care.
You can go from a stage 1 to stage 4. And
Sears just wants to know if she has cancer or not, while there are still hospital beds available. Christine Birak, CBC News, Toronto.